Hello there. I'm Kate Walsh, and I'm here today with Dave Maffio, Senior Director of Support Services here at Boston Medical Center. So, Dave, you and I have spent a lot of time in recent weeks as we've prepared for and responded to this pandemic. And because we're in a phase C of the hospital incident command structure, your role, which is pretty broad on a regular day, has taken on additional dimensions because you are the logistics chief.
Yes.
And much of our response to this pandemic has been all about logistics. So could you take a minute and talk a little bit about what you do in that role? And then I have a few more questions for you.
Sure, absolutely. So the logistics chief's role is really to make sure we have supplies readily available, people deployed when operations need it, food, so on and so forth. So during this whole event, it's very supply driven. So we're making sure that we're vetting companies, making sure products are ready available to the floors when they need it.
So I get like 100 emails a day, and you must get 300 emails a day, all of whom say, I've got a guy and he's making masks. So talk a little bit about when we get one of those emails. They come from really famous people around town, and they come from people who have something in their backyard or in their garage. Talk about how you decide whether a mask is fit to go into our supply chain.
Sure. So what we do first is we vet all the companies. So Scott Rutledge and his team, they've made over 250 calls to these companies that had a guy that had a mask. And then when we bring them in, I make sure that I bring them to infectious disease to vet them. So like we did for the surgical masks that we're passing out every day. In N95 mask, Bob Whitfield and his team, they look at the masks and they fit test accordingly. And there has been some masks that we just haven't accepted just based on the efficacy.
So you and, say, Dr. Nahid Bedelia will look at a mask, run it through a test, and say this works or this doesn't.
Absolutely.
So if there's a mask that's on a floor at BMC or in one of our lobbies that we're putting on somebody, your team and the physician leadership have certified that it's safe to use.
Yes, we have vetted all masks, face shields, any other PPE. And we've also changed the process a little bit so it comes through transport, which is under my domain on a regular basis anyway, so I keep a close contact with them.
So staff don't have to go looking for it, you're supplying it.
We're delivering it.
Could you talk a little bit, not only about environmental services and dietary, but all of the support service departments and how they're working differently in this pandemic to support our staff and our patients?
Sure. So in terms of environmental services, this is an environmental disease that we have to make sure we stay ahead of. So I'm so proud of the work that they do every day, staying ahead of the cleaning protocols, being vigilant and diligent, and the management teams work extremely hard to make sure we stay ahead of it.
Say one more word about the cleaning protocols, because just like PPE, the cleaning protocols change, and our guidance to staff changes fairly regularly. So could you say more about how you get that information out in the many languages that we that work here at our hospital?
Sure. So we're working closely with infectious disease on how this is ever changing. They come to our huddles as well as clinical educators. So they're teaching our staff, they're supporting our staff, they're letting them know how to be vigilant in the work that they do. There's certain chemicals that kill COVID, and we stay ahead of what those chemicals are, and we educate to contact times to our staff and the efficient cleaning of the patient rooms.
That's terrific. So my dad would say an army marches on its stomach. So talk to me a little bit about the team in dietary,
Yeah,
because
so
their work has totally changed.
Yes, great point. So, on a regular day, we'd have 10,000 meals flowing through our cafeterias. Really busy retail operation. They've changed, obviously. We've had to close a couple of our locations. So they've been more of supporting staff. So we've had a lot of food donations. They've fed the staff, nurses on MICU, emergency room staff, and other caregivers across the organization. So they're adapting to their new role of being more of a supportive and feeding people when they need it.
And the way we feed people has changed because everything has to be individually wrapped.
Yes. Yeah, so even with donations, so a lot of the donations come in, we make sure it's individually wrapped, whether it's sandwiches or individual pizzas. We deploy the food service team. They're doing a great job to make sure they delegate to those in need. So it's really changed. Even social distancing in our cafeterias. We've had to pull out some chairs and make sure there's separation.
I noticed that. So say a minute more about transport, linen, all the other things,
Sure.
your vast empire.
Yeah, so transport's changed a lot. So what we've decided early on is we had to conserve supplies. So we changed the process to all caregivers use Epic and order through transport, and then we deliver it. So if you need an N95 mask, you need a yellow gown, you need gloves, we take care of that through transport. So they've done a great job also keeping the metrics behind that, how we're doing conserving those supplies, as well as their regular job transporting patients and equipment. In terms of interpreter services, I'm really proud of them. They've evolved into more telehealth and how they're handling that. So on a given day, you'd have 65 interpreters going across the organization. Now they're making more calls over the phone, video, so they're more of a call center operation. And guest support. So early on, when we came out with our visiting policies, they did a great job kind of mandating those protocols at our front desk, and they're doing a great job moving forward.
Well, Dave, I want to thank you and your team, and I personally want to thank your teams who have really been on the front lines of this battle, along with doctors and nurses and respiratory therapists and social workers. I'm really proud of the work you've done, how much change has gone on. I want to thank you personally, and I want to thank everyone for tuning in today.
Thank you.